2001, we came to South Africa at the request of AIDS activists who came to us at the Durban conference in 2000 and asked us to help them advocate against their own government. They had heard that AHF knew how to advocate. So I came to try to see what we could do, and we decided the best thing we could do is to open a clinic. Because at that time, the South African government was not helping people with HIV and AIDS. People actually dying of AIDS actually get treatment. There was no ARVs and there were no clinics. So we said as an advocacy thing, we were going to open this clinic with the South African activists, which we did. And we hired all local staff, all South African doctors, nurses, and they were very courageous to come and start this clinic because at that time there was a lot of fear and denialism about the effectiveness of ARVs. But we decided to start with 100 patients and prove that treatment saves lives and treatment works. This is very difficult. The government threatened us. They did not want us to open this clinic. It was against everything they wanted at the government level. But the people wanted it. The people were begging us for help. So we decided we were going to do it, which we did, and it was a very difficult 5 years. I would say the first 5 years of the clinic, AHF paid for all the medications at the highest price, more than $5,000 per person per year, US dollar. But now, after 15 years, we have improved that relationship greatly. The South African government has changed out. There's a new policy. We're all working together, and it was, at one time we thought it was never going to be possible that in a situation so difficult that we could work with the government that would not want this model. So how does this relate to the Ukraine? It's difficult in the Ukraine as well. We've been trying to change the model in Ukraine. We've been trying to get the government to accept NGOs providing care and treatment along with the government system, integrate them together, that we're here to help. We're not here to disrupt the system. We're here to improve the system, to work together. So I know it's possible in the Ukraine because it was the worst situation in South Africa. It was absolutely terrible. The government did not want us. It was a threatening situation, but we pursued and we prevailed. And it's a very good situation. So this can happen in Ukraine. If we stay strong, we know that treatment can be improved. We know that testing and linkage to care, all of it can be improved and much more accessible in Ukraine. And this is what's going to save lives, and we just want to help. So we're going to continue pushing, showing the model. We call it model advocacy. We do what we think is right, and then we try to change the policy. We show it's possible, and then we change it. And that's what we're doing in the Ukraine. And I think that I am very hopeful that with working with the Ukrainian government and with the activists and the healthcare providers that really want to help, we're going to do it. And treatment will be available in Ukraine.